It's a big challenge, especially as we move from the leukemias and lymphomas to solid tumors, which are much larger indications comparatively. Colorectal cancer is the second leading cause of cancer death in the U.S. So we're looking at potentially tens of thousands of patients a year, compared to maybe a few thousand patients per year in the leukemias and lymphomas. So it's definitely going to be a challenge. Personally, I like the progress we're starting to see in the push to see decentralized manufacturing, sort of point of care or very close to point of care manufacturing options. There's a lot of hurdles there, I think. Automation of the process only being one of those. Being able to support with QC and testing requirements is another one, as well as the regulatory approvals that would be needed. But I think that would be ideally suited to be able to do that. Short of that, we're looking at shorter processes to be able to increase throughput, and certainly the automation will also help in creating high density centers for manufacturing. Logistics are getting worked out, but there's still a bit of work to do there because of the ultra low temperature, which we've seen in COVID with some of the low temperature storage conditions for the vaccine there, that things are improving, but still have some ways to go, especially for cell therapies. So those are some of the features that we really need challenges, and of course everybody always wants to know if we can lower the cost of goods as well, so we can have a more affordable therapy.